Yes, this is a voluntary and free program to all K-12 schools in Alabama. So that's public and private. And this is a partnership with the Alabama Department of Public Health, the Alabama State Department of Education, and we've all come together to mount this effort and offer these testing services in schools. And so the idea is it's asymptomatic sentinel testing, if you will. So really trying to keep an eye on any issues that may be brewing or any infections that may be brewing to really focus on maintaining children in the in-person learning environment.
Okay, and can you explain kind of how y'all will be working specifically with each different school districts? I know in the press release sent out, we talked about how they'll partner with UABs and local vendors to really individualize and specialize testing for each school.
Yes, we will. We are actually reaching out to schools as we speak through our connections with the Department of Education, as well as other partners, so independent schools, et cetera. And we will be working with them to understand what their needs are. So we may have a range of needs from everything. We need the vendor to come in and do all of it because we don't have the resources to do it, to we want test kits, we want to be able to have our nurses provide that service or work with the children to do the nasal swabs, not the brain swabs, just the nasal swabs, and really try to understand from the schools what will work best for them. So again, voluntary consent process with students as well as faculty and staff.
All right, thank you. And how can this asymptomatic COVID testing really help protect the faculty, staff, and students in our K through 12 schools?
So I think given that we have a couple of things going on in Alabama, as I know everyone is familiar with, we have lower vaccination rates. A lot of our school systems have gone with optional masking. And right now community spread is very, very high. So when we look at the risk across the state, it's very high regardless of where you are. And so the idea behind this sentinel or asymptomatic testing is to be able to say, just have an understanding of what's going on, that a lot of particularly children a lot of times will be asymptomatic, and with the Delta variant being so much more virulent, that we need to make sure that we have a good understanding of sort of maybe what's brewing at the surface, if you will. So just keeping an eye on that.
Okay, and then we have a submitted question from Eddie. How many school systems have already agreed to participate at this point? And is there concern if not enough school systems agree to do so?
So we are, again, working with, these are CDC funds that have come through ADPH to UAB. And so we're working very closely to recruit as many schools as possible. So we do have a pilot school that is going to work with us to understand this process, to help us work with the vendors, to help us understand how to make this the most flexible process that we can with these schools. So we do have one on board. We've been talking to other public schools, and we have a number of private independent schools that are on board as soon as we can get the process set with vendors.
Okay, and you just touched on this, but to clarify, this program is available for private and public schools, correct?
Correct.
All right, and when is this expected to roll out? I know that we had several schools across the state start last week or this week. Have we already started the program, or is it still kind of in the rollout phase?
We're still in the rollout phase. I think this is, still trying to understand. We've been doing a lot of work with the vendors to understand what the options are in terms of needs. This is rolled out in other parts of the country, and of course we want to make sure that it is specific to Alabama and specifically meets the needs of the local school districts. And so we're working with them right now. We do have plans for this to start at least in our pilot system, as soon as possible, and certainly working through that. So as soon as we can get the agreements up and going with our vendors, we should and get everything squared away with schools, we'll be ready to go.
All right, thank you. Lauren, I see you have your hand raised. If you would
Yes,
like to unmute and ask your question.
thank you. You mentioned that there was a pilot school identified and some other school districts that have already showed interest. Can you share what is that pilot school district and what are the others that have shown interest?
That's a great question, and I have not gotten their permission to share that, so I would have to get back to you on that.
All right, thank you. I know you mentioned you have to get permission from the schools, but do we know yet any data that comes from this testing? Is that going to be shared with the public through the school system? How is that process going to work?
Well, that really depends on the school system. So in terms of their sharing it for themselves, but all of the data that we have in terms of positive test and any of that information will be reported to ADPH, and that will be included in the numbers as best I understand it. Or that is my understanding, I should say, that those numbers will be included in that information. But in terms of individual specific school districts, thinking about the dashboard that came out last year, I believe it's supposed to start again in September. That's really up to the individual school system to report those data.
All right, thank you. And then how many vendors are y'all working with?
That is still yet to be determined. So again, we're still trying to figure out what the needs of the schools are, and then also trying to work within different business models of the vendors. So we've done a request for information process, and we are on the tail end of that and are starting to have those conversations with vendors because they do things a little bit differently. We have some that will do turnkey, a turnkey solution, which is basically they come in, they set the test site up, they work with the students and faculty and staff to do the testing, and then they roll everything out from consent, et cetera. But then we may have schools that the model needs to look a little bit differently. So we're trying to get as many players on board as we can to be able to respond to the needs of the schools.
All right, thank you. Lauren, do you want to ask your other question?
Hey, yes, thank you. Is there a percentage or a target number of each school district's population that you would aim to test each week?
So that varies really depending upon, again, access at the school, the number of students that consent. We certainly want to work within the guidance of ADPH, of CDC, and think about community spread. So we have some of that information around the types of tests that we will do. That changes with the percent of community of transmission across the community. But in terms of numbers, it can range from 10%, 20%. So there's some variability there. But we do want to work within the again, flexibility with the schools, but also working with the expertise of the vendors as well. So based on numbers, so really engaging that group, that group of experts in the mix, keeping them in the mix as well.
All right, thank you. Randy, would you like to ask your question?
Yes, I know the money is from the CDC, and I know we only have one pilot program right now. We're looking at potentially bringing some other schools on, but how much money how many schools can be supported with this money from the CDC? So is it enough for every single school in the state of Alabama to participate in this program?
That is our hope. I mean, the total amount was $147 million that came from CDC to the state of Alabama. So the hope is that, yes, with our 800,000 plus K-12 students, that doesn't include faculty and staff. So when you think about if we're going to focus on, some school systems may choose to focus on children that aren't eligible for vaccination. So the K through 5 to 6, 5th to 6th grade, and others may take a different approach. So again, I think the funds are there. It's just kind of managing what the school needs and sort of what makes sense from a scientific perspective. And we do have a scientific advisory committee that is made up of a lot of names that are well known. Dr. Kimmerlin, Dr. Sag, Dr. Nafziger, and others, community pediatricians. We have a task force that includes the Alabama chapter of the American Academy of Pediatrics, Children's Hospital. So we're really working, this isn't just a UAB specific project. We're really trying to engage all of the expertise across the state and understand and make sure that we're able to pivot as needed. So as the landscape of the virus changes, we want to be able to respond to that. So again, going back to your question about funds, our hope is that all of these funds will be utilized so that all of the schools will have the services that they need.
Can I ask one follow-up to that?
Go ahead.
And this is, I know ideally every school, and this is something that we are looking to do for the entire school year, or the time frame for when we would do this is kind of, we don't know how long we would do this just yet.
The idea with this specific project and this particular bucket of money, if you will, is the time frame is to the end of July 2022. But again, it could be that certainly right now we have high community transmission, high rates of infection, or of high case rates, et cetera. So we may want to focus that testing right now. And then if there's a lull, we can adjust. And then if there's another time when we want to come back in and do that testing, I think that's certainly a part of this. I think one of the things that we've heard from our partners is that, the last year there was, at least from our school nurses, from their experience last year, is that rates of flu, rates of any other kind of illnesses, that respiratory illnesses that were seen in schools really didn't exist. So I think the idea of, will we ramp back up during flu season? Will we ramp down during the spring? I think it just depends. And again, we're trying to build in the flexibility that we need to be able to adjust in those areas.
All right, thank you. Lauren, your other question?
Yes, thank you. Who exactly would be tested? Would these be random, or would they be focusing on certain classrooms with known exposures, or how would you choose who to test?
So again, it's asymptomatic sentinel testing. So it's really, there's a number of different ways that it could be done. It could be an entire classroom that's randomly chosen. In some cases, there may be sports teams that are tested just from that perspective. So it really depends. But again, it's the idea is asymptomatic. And so, going in and maybe testing part of a classroom or a whole classroom, if you're thinking about a lot of the models with kindergarten through fifth grade, where most of the time the children stay in the same classroom, that idea of that pod being your closest contact. So testing all of them. And again, there's variability across the types of tests that we would use. And right now, I think the rapid antigen is the one that it's being recommended by our scientific advisory committee. But again, that could change to where it could be pooled samples, where you could see if there was a positive test in a pool, but that's really more applicable for lower community spread. So again, it just depends on what the school wants, and sort of in partnership with us, with the vendor, figuring out what makes the most sense.
And I have a follow-up question. It could be for you, or I also saw Dr. Landers on the call if you both want to address it. But how often in Alabama right now are we seeing asymptomatic cases in children? And how could this affect spread through both schools and the community?
I'm happy to give it a shot, but I'll certainly yield to Dr. Landers if she would prefer.
Sure, go ahead and I'll follow up with you. Thank you.
Okay. I think as we've seen previously, I think asymptomatic spread, again, the Delta variant is different than what we saw last year. There was a lot of communication about how children, they weren't necessarily as susceptible to catching COVID, if you will, and spreading COVID, et cetera. But I think now that game has changed. And in terms of actual numbers, that would be something that I would ask Dr. Landers, because I haven't seen anything recently in terms of Alabama specific data, and I'm not sure that we're quite there yet. But I think in a lot of cases, there is asymptomatic spread, and I think that's the reality that we're in. So I think in terms of taking this approach, we will be able to catch or to capture that and be able to keep those children in the classroom. Dr. Landers?
Sure, and thank you so much for that discussion. I think it's extremely important that we understand that the Delta variant represents probably about 90% of what we are seeing in the state of Alabama, if not more. And we are dealing with a virus that is a bit different from the original or the wild-type SARS-CoV-2 that we saw in terms of the transmissibility, the ability to adhere to the nasal pharynx, ability to really wreak more havoc. And so I think this is a concern that we have to recognize, and also know that previously with asymptomatic spread, if we look at some of the national data, then we could see that as many as 15 to 20 to 30% or more of cases wound up being asymptomatic cases. Again, if you're asymptomatic, you're not necessarily going to go be tested, and that's only a snapshot in time. So I think we need to absolutely educate and remind parents and caregivers that asymptomatic transmission and asymptomatic cases obviously do occur. And we must get away from the misunderstanding that children cannot transmit COVID, because they can, and that children do not get sick from COVID, because they do. And I think that's the utility of this kind of program. First of all, it will give us better information on the asymptomatic cases, the asymptomatic transmission, the data that we need. And secondly, it will be a way for us to further reduce the risk of kids in the school system. We all want kids back together, and I see this as a very important element of that. I just really want to thank UAB for what they are offering here, and I really want to encourage more schools to take advantage of this. Thank you.
All right, thank you so much, Dr. Landers. Just real quick, can you please clarify? I know that we talked about how it might be a classroom that gets tested, it might be a sports team, but students will only be tested when they have written consent, correct?
Correct, absolutely. That faculty and staff must consent. Parents consent for their children. So that is built into every step of this process. So the first step being school systems, school districts, schools, they agree to do this voluntary free process, and then it goes from there in terms of the consent process with parents for their students if they are of the appropriate age, which most we're talking about children that would have to have parental consent for this, as well as the faculty and staff in the schools.
All right, thank you. Randy, would you like to ask your question?
Yeah, it kind of is just understanding the process of this. I know that you guys are looking to roll out this at a pilot school as soon as possible. You're working with vendors to understand the logistics workflow of that. You are in conversations with other schools to potentially bring them on. And the big picture is to get it to every single school. I guess my question is, at one point, are we transitioning from the pilot to the other schools to the rollout to everyone? Or is what you're saying the timeline for all of that is to be determined until we can work through the vendor situation?
Well, I think in many cases, and I'm not trying to dance around the question at all. I think this is in some cases this is a quick rollout where we've joked as a team that we're sort of building the plane as we're flying it. So we're learning a lot about the vendors, about the schools. You know, we know bits and pieces, but when you put all that together, so I've called one of the schools the pilot school. They're the guinea pigs. We laugh about that. Good relationships there, which is nice. So I think once we have the things in place that we need to have in place in terms of everything from, you know, the agreements with schools so that they know what they can depend on our UAB team to do. And then subsequently, UAB has the vendor agreement in place so that we know what we can depend on the vendors to do, and vice versa. Once we have that kind of template in place, we should be able to roll this out fairly quickly. So I think a lot of this is just getting these pieces and parts in place. And again, kind of working with that pilot school to help us, you know, work through any of the catches that might come up with, if you will. But the idea is to be able to get that process in place and then be able to kickstart from there. So hopefully that makes sense. Hopefully that provides you with a little bit more understanding.
All right, and say that there are school districts who are interested in this program. Can they go ahead and get in touch with y'all and kind of get that process started?
Absolutely. And I believe that you all have our website as well as email address. So connecting that way is a great way to do it, certainly. And we're actually doing an active reach out to schools that responded to a survey of the Alabama State Department of Education last spring, saying they would be interested in this process. And, you know, again, trying to do the reach out to make sure that folks know about the program. So either way, we're trying to make that line of communication open. Either they can reach out to us, we'll reach out to them, but we're just trying to get this information out there and available.
All right, thank you. Lauren, would you like to ask your question?
Yes, a follow-up to what you were just talking about with the pilot program, and I apologize if I missed this, but has the testing in the pilot program already begun, or is it expected to begin this week or next week? Or
it should begin in the next few weeks, so it has not started yet.
And if a child does test positive, what's the guidance right now on quarantining?
So that follows, I mean, that follows, my understanding is that follows the ADPH guidance on that in terms of quarantine, but there is my understanding is that there is some variability within schools in terms of masking and whatnot. So again, it depends on what the situation is within the school. Dr. Landers may be able to clarify that, but my understanding is that a masked child who's been exposed, a child who's wearing a mask, an exposure, and or the child has been vaccinated, there's no expectation for isolation or for quarantine. But again, I think there's the school-specific information, and that will potentially, I guess, vary across private schools or independent schools. Dr. Landers, you may want to provide some clarification to that.
Certainly, and our school guidance is on our website, and the way we want to remind persons to look at this is that really isolation and quarantine have not changed in terms of CDC and ADPH guidance. Isolation, of course, is the case 10 days from onset of symptoms or 10 days from time of test if we have an asymptomatic person. In terms of quarantine, persons who are defined as contacts. And again, we have the exception, as you alluded to, in the classroom. We have the exception in the classroom, K through 12, with students. If both students are masked and maintaining a distance of 3 feet or greater, then obviously the person that is the contact, again, meets the definition of an exclusion, so they would not be a contact. Now, in addition to that, if a student is fully vaccinated, which obviously can only be 12 years of age and above, or the person has had COVID-19 disease documented within 90 days. And again, all of this is on the website in the isolation and quarantine guidance. And I want to just continue to remind, as we're talking about this kind of testing right here, is this is a further way to protect our children and to keep our children in-person learning. And as a pediatrician, I cannot stress that enough. but we need to use all the tools in terms of masking, in terms of mitigation standards, in terms of the availability of this great asset of testing, and also follow isolation and quarantine to further get this virus under control. Thank you.
Thanks, Dr. Landers.
All right, Andrea, would you like to ask your question?
Yeah, I just wanted to clarify. So this would be a PCR test. Is this a rapid test, or do they get the results in a couple days? When do they find out the results?
So originally, when we first started talking with our scientific advisory committee about this program, the PCR test was the recommended because community spread was actually very low. So when we started this conversation, midsummer, things were looking very positive. Really, that's changed over the last few weeks. So given the high rate of community transmission, the recommendation based on CDC guidance for this project, as well as just in general, with a higher rate of community transmission, we're going to likely be starting with the rapid antigen testing. So being able to have that information more quickly. Now, if we have the ability later in the fall, hopefully that we'll be able to have the transmission rates within the community will be lower, we will shift to the PCR testing, which is actually more the rates of false negatives, false positives is actually is lower. And so wanting to make sure that we have that information there. But right now, the recommendation by our scientific advisory committee is that rapid antigen is the way to go. But again, that can shift, and we're constantly looking at the environment and the context of where we are in the state and in the local communities as well.
And how do they collect the steps for the rapid antigen test? Is that a prick to get blood, or is that in the nasal swab?
That is the tickle the nose swab.
Okay.
So we actually, on our website, we actually have some videos that show the swab. So it's, again, as I was joking earlier, it's not the brain swab, it's the tickle the inside of your nose swab. And in some cases, we have vendors that have worked with children that can actually do the swabs themselves. So we'll see how this rolls out and what the schools and the school districts want to do in terms of how to engage their students in this. So it's the easy tickle the nose, nothing super invasive.
And I had one more question about the state dashboard. I think you said it'll go live in September. There's some counties, when you look on the website now, that are reporting cases. Is that just incomplete data, or when can direct parents, to look at that tab and that be an accurate case for that school district?
So and maybe Dr. Landers could address this, but my understanding is that is up in that's still a work in progress in terms of the dashboard, but also that schools, it's voluntary in terms of school reporting to that particular school dashboard.
And just to follow up on that, yes, and of course we had the school dashboard last year. The reason it will be a couple of weeks getting this back up and running is obviously not all schools start back at the same time, and so schools have to have the opportunity to have all their processes in place. And I think all of us respect and understand that schools don't just do COVID, and they don't just take care of situations related to COVID. They have many, many other aspects of being able to educate our children. So again, this process, while it was voluntary last year, we had outstanding participation from the schools, because the schools do want to be transparent and they want to make sure that parents are receiving this information. But I do remind people that when we have as widespread a community transmission as we do, keep in mind that kids don't just go to school and come home. They go lots of other places, and schools interact with other schools. So just seeing that one school is a little bit lower this week or another school is a little bit lower that week, we have to take in mind what else is going on there. Certainly some schools are following the recommendations to universally mask, and that is going to make a difference in terms of transmission. Other schools have done mask optional. That's also going to make a difference in transmission. And I think that's why testing, a very strong proponent of testing myself, and I think that's why testing is such a great asset to be able to augment our ability to keep these kids and also our faculty and staff safe. Thank you.
And I think that's a great point. I think the idea, we know that children are very resilient, and, generally speaking, our children's hospitals, they sit at a space to where, there's an in and out. So the idea that children are vulnerable to this, but I think the idea that this testing program can hopefully keep them safe and keep them in the classroom, and particularly some of our areas across the state that have different resources or are lower resource. The idea of a school system that has higher rates of free and reduced lunches, that this program can actually help keep them in the classroom, keep them engaged, and really working on that. So I think so as Dr. Landers said, there's the testing, the COVID piece of this, but then there's that much bigger picture that's really important, that the health and well-being and safety of children, faculty, staff, and making sure that our children are able to be in the places that we want them to be, learning, being with friends, doing all of the wonderful activities that they're able to do. And I just can't, as a parent, I can't underscore that enough, that certainly we want our kids in the classroom with their friends, engaged in that learning space, but also for children who need to be there because that is the safer place for them, versus at home, versus in the community, whatever that may look like. So I think, again, this opens that conversation up to, that big picture of health and well-being.
All right, thank you. We're going to take one more question. Lauren?
Yes, thank you. I know this program is new. Are you aware of any testing that was done widespread in school systems last year?
Yes, there are a number of programs in the Northeast, Massachusetts, and they've used different models. So we are taking the model that we're working in partnership with Alabama Department of Public Health as well as Alabama State Department of Education. But in some cases, the funds for this project, all CDC funds from the state, some of them in some cases went directly to the school system, and that's our model looks a little bit differently. But Massachusetts, there's some great information there on how to choose vendors. A lot of our processes we're pulling from that information. So this has been done, but again, we want to make sure that it fits with our context and with our schools, and this idea of working with each other, with a partnership. So hopefully that helps. But I know Massachusetts is one great example of how this is rolled out across schools.
All right, thank you. And then do you have anything else you would like for us to know?
So I think, again, I think the idea of asymptomatic COVID testing in K through 12 schools, public, private, the whole idea behind this is it is about keeping kids safe, keeping them in the classroom, making sure that faculty and staff are safe and stay healthy. I mean, I think when we think about our children, having that stability of being in the classroom, being with the teachers, being with their friends is really critical. And this is one way that we want to be able to do that. And certainly working with all of the individual school districts that have variations in terms of how they're approaching their health and wellness plans. But again, this is another tool in the toolbox, if you will. So I hope that there will be a number of school districts that will take part in this and take advantage of this opportunity and really want to work with us in this partnership and figure out how to make this happen in the best and most effective way.
All right. Well, thank you so much for joining us today. And thank you, Dr. Landers, for also hopping in. A recording of this Q&A will be sent out in just a little bit. Adam dropped some of the information about their website and the link to the full release. I also know that ADPH sent out a back to school toolkit beginning of the month, and information about this program is also in that toolkit. So thanks for joining us and have a great day.